An alarming new evidence of a major COVID spike across America ahead of the holidays. Omicron is now the dominant strain in this country, making up 73% of new cases. So in the last 7 days, there have been nearly 930,000 new COVID cases. Yikes. More than 204 million eligible Americans are fully vaccinated. That's just over 65% of those who are eligible, but less than a third of eligible people have gotten the boosters. President Biden is addressing the nation later today. And we're joined now by his chief medical advisor, that's Dr. Anthony Fauci. Dr. Fauci, as always, it's good to have you here. You're coming at a very good time because people are frightened and they are confused. And let's talk about the increase in the Omicron cases and the breakthrough with the boosters. That's what has people very, very concerned. Because you say, get vaccinated, get boosted, you're protected. That does not appear to be the case. Help us understand what's happening to us.
Well, when you're dealing with a virus, a variant like Omicron, which has really a spectacular capability of spreading from person to person, we will be seeing breakthrough infections of vaccinated people, as well as people who are vaccinated and boosted. That is going to happen. The issue is that people need to understand that even with that, the likelihood of a vaccinated and boosted person of getting seriously ill from the infection is very, very low. It's the unvaccinated people who are the most vulnerable, not only to getting infected, but to getting a serious outcome. So I understand how there could be some confusion. You tell people, please get vaccinated, get boosted. Even if you do get infected, you are largely protected against getting seriously ill. And that's the thing that people need to understand. They shouldn't throw up their hands and say, well, if you can get infected, even if you're vaccinated, why get vaccinated? There is a very big difference, Gayle, between a vaccinated and an unvaccinated person when they get infected with regard to the consequences of that infection.
And so if God forbid you do have one of these breakthrough cases, are you highly contagious? What needs to happen if you do have a breakthrough case?
Well, if you have a breakthrough case, you should be doing what everyone who gets infected should do. You should isolate yourself for a period of time. If you do get sick and you get some symptoms, you should notify your healthcare provider and see what the best thing to do is. But as I mentioned, the likelihood of getting significantly ill is going to be very low. So what it would likely be is that you'd have to just isolate yourself for a while. It's really very important, Gayle, for people to get that point, that you're going to be reading about breakthrough infections because this virus is extremely good at transmitting from person to person. But vaccination and boosting clearly is the answer to protecting yourself from infection, but even if you do get infected, protecting yourself from severe disease.
But Dr. Fauci, when it comes to those vaccinated and boosted people who get a breakthrough, I know they're less likely to be hospitalized. Are they also less likely to transmit it, in particular to other people in their family who are also vaccinated and boosted? Can you say anything reassuring about those maximally protected households?
We have a lot of data with regard to Delta, and we know that if you have a breakthrough infection with Delta and you're vaccinated versus unvaccinated, although you have a high level of virus initially in your nasopharynx, it drops rather dramatically and quickly when you're vaccinated, which means you would diminish the time frame with which you're infected to someone else so that you would not be endangering someone else. There will be a period when you will be able to transmit the virus. And that's the reason why when we talk about the importance of a comprehensive approach, not only getting vaccinated, getting boosted, but when you're out in congregate settings, in situations where you don't know the vaccination status of people, it's very important to wear a mask. That is critical.
But Dr. Fauci, that period of being infected or infectious, meaning you can spread it, is really important to people right now because so many people are boosted, but they're getting a breakthrough case, and now their holidays are ruined.
Right.
But what I hear you saying is maybe not. Maybe they can take precautions with their family and feel relatively safe.
Yeah, let's get this straight for people, because there is always this concern that we're saying, well, no one can enjoy the holiday because of the Omicron. That's just not the case. If you are vaccinated, you're boosted, your family's vaccinated and boosted, you could feel comfortable in the home setting of a dinner or a gathering together with family and friends who are in fact vaccinated and boosted. There's never a zero risk in this world, but the risk of having an issue when you have the conditions that I mentioned, the vaccinated and boosted in a home setting, not in a big 100-person indoor setting, that's an entirely different thing. That's quite risky no matter what the circumstances. But when you're talking about what we all love to do with your family, I have my family, my wife and my children are in right now. We're vaccinated, we're boosted. I feel perfectly comfortable in the home with them, having a dinner, having a social gathering.
Okay, Dr. Fauci, speaking of comfortable, I want to ask you about that, how we become more comfortable with COVID. We hear you, okay? So Omicron is highly transmissible, and if you're vaccinated, it's not as severe. It's mild from what we hear, and if you're unvaccinated, results can be different. But could Omicron and these other variants spread to the point where we have population immunity and we begin to live with this long term like the common cold or flu?
That's entirely conceivable and likely, as a matter of fact. We are not going to be in a situation of this degree of intensity indefinitely, for sure. And what we're hoping that when we get through this Omicron wave, that we will have enough people vaccinated and or having been infected and recovered well, that there will be a degree of immunity in the community such that you don't have a situation where it's dominating your life, where the level of infection and control is very low. We hope we get there soon. In our own country, we first got to get the 50 million or so people who are eligible to be vaccinated who've not gotten vaccinated. That is critical. If you want to keep the level of spread in the country as low as possible, which would get us back to some degree of normality, you got to get those unvaccinated people vaccinated, not only for their own protection, because you don't want them to get sick, but it's important to keep the level of dynamics.
Yeah, they're done.
Those people, Dr. Fauci, they're not listening. I'm trying to, be very charitable,
I think
realistic, but they're not listening. Before you go for your Christmas holiday, how far advance should you get tested before you go? Christmas is Saturday. Should you be tested on Wednesday, Thursday, Friday? When should you get that last test before you go?
Yeah, I mean, if it should probably be within 1 to 2 days. Now that we have a greater, and that's what the president is going to talk about, 1 or 2 days before,
Okay. All right, Dr. Fauci. Your birthday's Christmas Eve, but you're working 24/7. I hope you at least get to have a piece of cake at some point during the day. Thank you. Thank you so
Thanks,
much.
Gayle.
Looking
good
going on, closing on to 81. Thank you, sir. We want to hear your questions about this pandemic and the Omicron variant. You can post them on our CBS Mornings Instagram, Twitter, or Facebook pages. Yep, we have those. CBS News Chief Medical Correspondent Dr. John LaPook will answer some of them this Thursday on CBS Mornings.